Hey guys, welcome to our channel Medphonics Talks. My name is Mohammed Unes. I'm second year medical student from Farghana Medical Institute of Public Health. So in our previous videos, you have seen that about the videos on general anatomy. So now we are going to discuss about the questions regarding from this topic, and these questions I have been taken from BD CHAURASIA. So end of the chapters, they have given some of the questions like 10 or 12 questions. So out of that, from my video, you can at least do 10 questions out of that. This is not a important topic like general anatomy, but you should focus on this because you want to, if you want to study more about anatomy, you should study general anatomy at least. So you can see the first question here, name the founder of modern anatomy. In the question, they have been stressed and asked for the founder of modern anatomy, right? Who is the father of or founder of modern anatomy? Father of anatomy is different and founder of modern anatomy is different, right? So here are the options like Vesalius, Herophilus, Galen, and Da Vinci. So Vesalius having some connection with the human anatomy. We will talk about on the later questions, and the answer will be Da Vinci. Option D, Da Vinci is the answer. The founder of the modern anatomy is Da Vinci. Next question, the father of medicine. So you already heard the name Hippocrates always, right? You have in our class 11 and 12 also you have studied about Hippocrates there. Definitely he is the father of medicine, okay? So Herophilus also having some roles, I will talk about that later, and Galen and Vesalius also having some of the roles, we will talk about that later. The option is C, Hippocrates. Hippocrates is the father of medicine. So next, the third question is the name the father of anatomy. Who is the father of anatomy? We have talked about the founder of modern anatomy there, and that was Da Vinci, and this is the father of anatomy. We can focus on Herophilus now. Herophilus is the father of anatomy. Actually, there are lots of fathers nowadays, like for modern anatomy, the traditional anatomy, then the who is having like whoever modifying the anatomy, they all are known as father. Like here, Herophilus, according to the option, Herophilus is the father of anatomy. Then next question, phylogeny. Phylogeny is a developmental history of a human. So this topic I haven't taught you in the general anatomy, but now in the questions we will talk about that. Phylogeny is the developmental history of a human. Options given: through evolution, before birth, through life, from birth to death. So phylogeny, you have studied phylogeny in your class 11, right? It is a developmental history of human, and this is according to the evolution. According to the evolution, the phylogeny is historical. Like we are studying about a human according to their evolution. We were being primates before, right? Now we are Homo sapiens, like that. So phylogeny, the answer A, through evolution. First option is the answer. Next question is ontogeny. Ontogeny is developmental history of human. Again, they are asking about the ontogeny. Phylogeny, always remember, philo is based on evolution. You have already learned in your class 11th and 12th. Then ontogeny. Onto means that developmental, which is from the fertilization till death. From the fertilization till death, this type of development is known as ontogeny. Always remember, onto means life, total life, from the embryological or the fertilization to the death, until the death of the person. Next question, now we are going to talk about the positions, planes and all. Anatomical position has following features except there are 4 options given. Person standing erect, forearms are pronated, feet together, eyes looking forwards. I have told you that anatomical position is that it's not a normal position as we are doing in our daily basis, right? I have already told in that session before. Person standing erect, it is right answer, I have told, right? The eyes should look forward and looking on a focused on any point. So option A and D are right. Like they have, and read the question well. In the question, they have asked you specifically that following features except. You have to focus on the exception here, not the following characteristics, right? You want to focus on the exception here. The person is standing erect, it is not an exception, it is a characteristic. Next one, and I have told that eyes look forward, it is also answer. The characteristic. Next one, forearms are pronated. Let it be there now. And feet together. Feet are always together, right? So C is also the answer. So who is the exception here? Yes, definitely. B is the exception here. Forearms are pronated. In anatomical position, the forearms are supinated. This is a supinated portion and this is pronated portion. So next question is, which statement about the coronal plane is incorrect? Again, they have been focused and stressed here incorrect. So out of these options, you have to select the incorrect one. First option is divide the body into anterior half and posterior half. Okay, so before that we want to discuss about one thing. You know that coronal plane, right? You remember coronal plane? I have told that this, if you are assuming this as my knife, then I have to cut my head like this. Okay, my body would be like this. You can see my anterior and the posterior half. So divides the body into anterior half and posterior half. This is a right answer. Then lies at right angle to the sagittal plane. Okay, this is like a kind of max. Okay, so if I'm going to cut this, it will be like it will be cutting my anterior and posterior side. Okay, suppose if this is a person and someone is cutting like this, okay, coronal plane, which means that I am going to cut, and in the option they have given that lies at right angle to the sagittal plane. So sagittal plane is the other plane just side to the just away from the median plane or the mid portion of the body. So I'm going to cut like this. Okay, I'm going to cut like this. So that means that if I am going to cut in a coronal portion, you can see here as a right angle. This is also right answer. Next one, lies at right angle to the transverse plane. Definitely, if this is a coronal, if I am going to cut transverse, means that like this, right? So if that will definitely will have a right angle there. This is also right answer. C is also right answer. So definitely, what will be the wrong answer here? According to the option, which is the right answer? D is the right answer, which divides the body into right half and the left half. No, right half and left half, it will be neither the median plane or the sagittal plane. So next question. Define abduction. What is abduction? You know that abduction I have told, right? Just remember adduction before you are talking about the abduction. Adduction is add, which means that towards the body. So movement away from the central axis. Away from the central axis. It is right? Okay, it is a doubt. Okay, so we will go to the B. Movements towards the central axis. No, towards the central axis means it is adduction. So it is not the right answer. Approximation of the ventral surface. Definitely no. It is approximation of the ventral surface means coronal plane, something like that. Definitely this is not the answer. Approximation of the dorsal surface. Definitely it is also not the answer. So what is the answer? Option A, movement away from the central axis is the answer. So the doubt is clear. So if it was a defined adduction, then what you will say? Movement away from the central axis is the abduction, and if it is adduction, then how you will tell? Movement towards the central axis. Okay. Next question. What is the position of forearms in the anatomical position? In the second question, we have already discussed here. Anatomical position has the following features except forearms are pronated. These are wrong answer, right? So you know that what is the position of forearms in the anatomical position? Pronated? No, it is not pronated. Mid prone? No, you know, it's like a mid prone is another type of plane or position. We will talk about that later. I have already told many times. We will talk about this later. Actually, if we are going more about this bones, the skeleton, these kind of things, you will study more about the positioning of the parts of the bone or the muscles. There we will talk about these kind of planes, positions again. So you will get to more, because you will get more examples to that topic. Then option C, supinated. Yes, it is supinated. I have already told that anatomical position will be like eyes will be straight, the face will be straight, the body will be straight in erect position, and the supinated arms and the feet will be forward. The next one. Plane at a right angle to the long axis of body or body part is. Plane at a right angle to the long axis of the body. Plane at a right angle to the long axis of the body. Long axis of the body. Right angle. Which will be the right angle? Long axis means, suppose this is the long axis, right angle, definitely it will be like this, and here is the right angle here. So if it is a right angle, then what plane I have drawn here? This will be the horizontal or the transverse plane. So the option C is the answer here, transverse or horizontal plane. So now we are going to talk about something else. There are only 4 suffixes in the anatomy. You have already heard it before. Itis, ectomy, otomy, and ostomy. Now we will talk about itis now. What is itis? Simply, itis means inflammation. Itis means inflammation. So what? There are so many reasons because of happening of this inflammation. It is you will talk about and study about that in the pathology. Now we can focus on anatomy, why this name came here. Itis means inflammation, which means that some part of the body is affected and it have been inflamed or enlarged. That is inflammation, and that suffix we will use itis. So you have already heard this word before, right? Appendicitis. Appendicitis is a condition by which the appendix is inflamed. Or so inflammation of the appendix is known as appendicitis. So next one, another example, you can tell parotitis. Parotitis means inflammation of the parotid gland. Inflammation of the parotid gland. It is a parotitis. Or you can also tell that tonsillitis. You have heard many times this before. Tonsillitis. Tonsillitis is an inflammation of the tonsil gland. Tonsils here. Okay, tonsils. So next one is ectomy. 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 I have already told that tomy. Anatomy means to cut, right? Ectomy means you are removing something. Removing or removal of something from the body. So you are removing something from the body. It is known as ectomy. Give one example for ectomy. Hysterectomy. Hysterectomy means a removal of uterus. Hyster means uterus. So another example for ectomy. Appendicectomy. Appendicectomy means the removal of appendix. What is appendix? A vestigial organ, right? Which is at the end of the cecum. Okay. Next one is otomy. What is otomy? Otomy means open and close. Open and closing of an organ. So why I am doing this opening and the closing of that organ? I have to open something and I have to take something out of that organ, then I will suture it back or I will stitch it back. These are known as otomy. You have don't compare lithotomy and this otomy. Okay, that is different and this is different. Otomy means, give one example for otomy. Laparotomy. Laparotomy, you have heard that laparoscopic surgery. You are going to open and you will close that, or you will open an organ and you will close that organ. That is known as otomy. Next one is cystotomy. Cystotomy. This is also you are opening the cyst, like it is a part. You will study about that. It is according to the urinary system, the genital organ and so on. Next one is ostomy. Ostomy, you are opening that and let it be open. Let it be open. Okay, you will opening that and you are keeping that open always. You have heard or you have seen some of the movies and the series and all. You have seen something there called tracheostomy. Tracheostomy. You are opening the trachea. You are opening the trachea to provide the high ventilation through the throat, right? Suppose this is a throat part. Suppose this is a throat part. Okay, this is the neck part of a body. This is the neck part of the body. You're going to keep an incision here. You're going to open and you will keep opening, and some of the tube will be there and it will be opened always, and through there the artificial ventilation will be there. This is known as tracheostomy. Next example for ostomy is nephrostomy. Nephrostomy. You are keeping open of the nephron or the kidney. You are keeping that opened and the urine will be taken out, and this is known as ostomy, nephrostomy. Okay, so we have talked about more 4 major suffix you are using in a daily basis: itis, ectomy, otomy, and ostomy. So these all we have end about the questions. So next topic we will talk about the bones, joints and all. I hope you have enjoyed this session and I hope you have understand every topic, because I have taught everything, and in my lectures also these are provided there. So watch that video once and you can do these questions by yourself. I hope you have studied everything, and stay tuned next video. Until next video, bye.